Hi, I'm Dr. Gary Nye, one of the owners here at Angel Animal Hospital in Springfield, Missouri. I run a service called Integrative Veterinary Services of Missouri, which is primarily a natural service for animals, and it does combine a little bit of conventional, so hence the integrative term, but we try to get by with as little conventional input as we can and rely on the animal's body to receive inputs and use its innate ability to heal and improve health. Today, I'm going to help you understand a little bit better what pet allergies are, particularly in the dog, and try to answer some of the frequently asked questions that pet owners have about dog allergies.
Can dogs have allergies like we do?
Sure, pets can get allergies just like humans do. And in fact, how they get them, why they get them, the problems that lead to allergies in the body are all going to be very similar between the species.
What kinds of allergies can dogs suffer from?
Yes, dogs and cats can both suffer from allergies that involve food allergies, environmental exposure, flea and tick allergies, contact with chemicals, and so on. All the major things that we think of.
What are the differences between environmental, food, and flea allergies in dogs?
Yeah, the big differences between the different types of allergies are basically the antigen or allergen that the body is responding to. If it's a foodborne allergy, then it's more than likely something they're ingesting that they're reacting to, although that can be environmental toxins as well, because there's plenty of pollens that get into food sources that our bodies are exposed through a inflamed gut, and the immune system will react to that. Environmental, you're going to have skin exposure, respiratory exposure, exposure, where you walk in the yard and get exposed to chemicals. There is a chemical type exposure. When it comes to fleas and ticks, it's going to be the bite of that insect that is going to cause the allergy, particularly with fleas. The saliva of the flea causes a very significant response in patients that are allergic to that saliva. The immune system in general is responding to whole proteins that it reacts to. And those whole proteins, again, can come through an environmental exposure or skin, respiratory, foodborne or ingestion type response through the GI tract, or it could be from a injection of something like saliva from an insect into the skin that the immune system is going to react to.
How do I know if my dog has allergies?
Typical symptoms that you're going to see can vary, but oftentimes in dogs, we'll see the ears and the anal glands really start with the first sign. So itchy ears, anal glands where they may be scooting on their butt a little bit. That would show maybe some itchiness and inflammation in that gland. Or it may proceed right to, or even start with generalized skin allergies where they're licking and chewing on their feet, maybe scratching their body. They might have red areas or darker pink areas of skin that are inflamed, and they're going to be itchy for the patient. And so itchiness, scratching, those are all signs of skin or generalized allergies of the skin, whereas foodborne are a GI type allergy where you've got inflammation in the gut. They could be vomiting, they could have diarrhea, they may have severe enough inflammation in that gut to where they just don't want to eat sometimes. They may have ulceration in the GI tract that causes them pain and discomfort. So signs are varied, but in the case of flea and tick, if they have a flea bite allergy, it's going to be horrendous itchiness, and they will be mutilating their skin and scratching and trying to relieve that itch.
What steps will a veterinarian take to diagnose a dog with allergies?
So diagnosis can take a few different forms. On the conventional side, it's often going to involve allergy testing, where just like in humans, there are injections of allergens done in the skin, and they will look at the reaction to those allergens. There are also some other tests where blood samples can be sent in now for allergy testing. Personally, I don't use allergy testing at all. It doesn't really serve a purpose in what I try to do for the patient. It is very much a conventional approach where you find out what they're allergic to and you try to avoid that in their life so that you reduce their symptoms. Unfortunately, avoidance is not dealing with the underlying reason they have the allergies in the first place. And so again, for me, that doesn't really fit the approach that I use, because I am trying to fix the underlying reason that that immune system is not responding appropriately to these allergens that the pet gets exposed to. So allergy testing really doesn't get used in my practice. I don't, again, consider it to be of economic value for the client and not of a therapeutic value for me with any kind of useful diagnostic information. I really don't care what they're allergic to. I care about what the underlying reason is that their immune system isn't responding or working correctly. And those allergens that they're allergic to today, if you have a dysfunctional immune system, they may be different or added to later on down the road. So you test them now versus a year from now, they're probably going to react to more things because that immune system hasn't been corrected yet.
What aspects of my dog's health can be affected by allergies?
So, what do allergies affect in your dog's life, or what other aspects of health might be affected? Well, you have to look at the underlying reason that they have allergies in the first place, and that's because the immune system isn't working right. And so, anything that relies on a properly functioning immune system could be at risk of having symptoms or clinical signs. If a dysfunctional immune system progresses on and gets more injury through over vaccination or things like that, well, you could end up with an autoimmune disease or even a cancer down the road. And so I really try to focus on that underlying reason that the allergy exists in the first place, and that is a dysfunctional immune system, and try to get that corrected in the body so that the body responds more appropriately to the allergens that they encounter. But things that you might see, it could certainly be loss of rest, stress on the body due to itchiness, and just not getting good rest. The gut is generally inflamed when the immune system isn't working right. Gut isn't working right, liver isn't working right. We generally have some low vitamin D and magnesium levels and so on. So there's a lot of things that may be at play here. But overall, there is dysfunction in the immune system, and there has been dysfunction in many potential pathways in the body that support immune system function that are also dysfunctional and need to be corrected. So those pathways are as varied as fingerprints on a human when it comes to an individual, comparing to another individual in the pet population. So we need to try to identify that as best we can and try to give appropriate inputs to correct that. And any of those dysfunctions can lead to its own clinical signs. So signs could be wide and varied, but certainly the itchiness, loss of rest, stress on the body, which becomes a vicious cycle with detracting from immune system function, and again, things with GI tract inflammation, diarrhea, vomiting, loss of appetite, and so on. In the case of respiratory allergies, you can certainly see coughing, sneezing, runny eyes, and it'll have a seasonal influence. Spring and fall are really bad for environmental allergens, and you can certainly see a lot of respiratory signs in those pets that are affected in those seasons, period.